When you log into the provider portal, start by navigating to the patient name. A SOAP note window will be open. Search the template based on the type of soap and start filling it. The SOAP note is divided into 4 structured parts. The subjective section covers the patient's primary concerns and background, including the chief complaint, history of present illness, medical history, and more. You can easily tick the relevant pointers that apply to the case. And then, in the objective section, document the patient's reported pain level on a scale from 0 to 10, and select the name of the person by whom vitals are taken. Simply record all vital signs and physical examination findings, such as height, weight, blood pressure, along with general appearance and other focus assessments. Moving on to the assessment section, you can enter your clinical diagnosis based on the findings. Then, in the plan section, outline the course of treatment, including procedures, vaccinations, therapeutic injections, imaging labs, referrals, follow-up plans. You can add a new outgoing referral, an applicable visit, or select the procedure codes. Once you've completed all sections, simply verify it by previewing a PDF from the top right. Once you've completed the preview, close it and sign off the note to finalize the documentation.